Okay, so today we're going to have an activity about activity number 8, no? About the malaria thick and thin smear. Okay. Okay, so by the way, no, this is different. Okay, from other. This is different from other types of procedure or activity in parasitology because we are going to use blood as sample. Okay? So uh, ito yung minsan class no na nako-confuse yung ating mga medtechs no kasi although okay, this is a procedure for a parasite, okay? Minsan ginagawa siya sa hematology laboratory. Kasi nga the specimen involves blood. Okay? So, para siyang smear na ginagawa natin sa ating hematology, pero, okay, meron siyang special procedure. Okay? Kung yung ginagawa natin sa hematology is a thin smear lang, okay, dito class, meron siyang thick smear. Okay? So, tingnan natin, no? So, I will go to upload a procedure. Okay, wait lang ha. So this is a bench aid, okay, from CDC, no? So it is a step-by-step procedure of the thick smear, okay? Nakikita niyo ba?
Ito akong saan.
Okay. So this is a thick and thin smear, no? So from the blood collection to, okay, papunta sa paggawa ng smear. Okay, wait lang ha. Okay? Basically, this procedure class is from the CDC. Okay? You can use capillary smear. Okay? You can use, or yung prick, no? Prick method. You can also use venous blood. Okay? Mag-extract ka from the veins. Okay? So, bakit ba tayo nagko-collect ito? Okay? Before class, this is when malaria is endemic in the Philippines, no? Okay? Maraming or series of trainings, okay? Ang pinerform or ginawa, okay, to accomplish this type of procedure. Okay? Hindi madali, okay? Hindi madali yung pag-collect ng smear. Pero the diagnosis portion is mahirap. Okay? Bakit mahirap, sir? Okay? Pare-pareho po ang itsura ng malaria parasite. Okay? Na nasa loob ng ating blood. Okay? The identification of malaria parasite will be based on the RBC. Kaya sinabi kong mahirap, class, kasi it really needs technique. Aside from counting the parasite, you first need to identify what type of parasite ang nandito. Okay? The usual parasite or the malaria parasite endemic in the Philippines is the falciparum and vivax. Okay? The rest, yung malariae and ovale, usually class, nakikita mo yan sa mga foreigners. Okay? Or yung mga... Pero I think, no, meron na atang vivax incident sa Philippines. Okay? So usually, yung 4 na yun class is endemic in Africa, South Africa. Okay? Doon talaga nanggaling yun. Okay? Or maraming incident ng malaria doon. Okay? Sa Philippines class, ang lugar na endemic tayo ng malaria before is Palawan, Mindoro. Okay? And take note, even Sarangani. Okay? Specifically, Maitom and Glan. Okay? Yung mga areas na yan before was really endemic of malaria. Okay? Ngayon, I think na-declare na nila na 0 cases na tayo of malaria. Wala na tayong cases as of 2015. Yun ang alam ko ha, as of 2015, 0 cases na tayo ng malaria. Okay, so di ba? They eradicated this malaria with the help of our government. Okay? Ano ba yung ginawa nila? Okay? Kasama yung iba pang mosquito-borne infection class, malaria, dengue, yung chikungunya, okay? Na ang carrier niya is mosquito. Gumawa sila ng project wherein they need to kill yung mga mosquito na yun. Okay? Meron silang fogging every week. And then meron silang distribute ng mga pesticide na nets. Okay? Yung parang mosquitero. Okay? Yung parang kulambo. Okay? Pero nakababad yun siya sa pesticide wherein hindi makakapasok or mamamatay yung mga mosquito na lalapit doon. Okay? Hindi ko lang alam kung sa inyo kung nabigyan kayo nun, no? Okay, kasi maraming nabigyan nun. Okay? Isa din yun sa mga ginawa sa Africa kasi. Ganun din ang ginawa sa kanila. Okay? And Africa is not, hindi sila progressive country. Okay? Wala silang budget. So the World Health Organization, no? Mga NGOs, okay? They help on distributing and helping the people in Africa. Ngayon, hindi na masyado ganun ka troublesome ang malaria in Africa. Right? Even here in the Philippines, ganun din ang nangyayari. Kasi nga, madali na siyang madali lang ikat yung chain of infection. Di ba? So, ang tinarget nila is yung mosquito. Okay? To stop the spread of infection. Okay? So now, sa diagnosis portion class, meron na tayong serological testing for malaria. Okay? Part din yun sa ginagawa na testing for blood screening. Okay? Yung magdo-donate, blood donor screening. Okay? For example, you're going to donate blood. Okay? Malaria serological testing is part or one of them. Part ng 5. Di ba? We have HIV, HCV, HBsAg, syphilis, and malaria. Okay? Malaria is the only parasite on the list of the serological testing for blood donor screening. Okay? So, bakit kaya kailangan i-test si malaria before ka mag-donate ng dugo? Okay? The fact class na blood-borne si malaria, kailangan talaga siya for testing. Okay? At meron kasing dormant phase ang malaria infection. Bakit? Anong dormant phase, sir? Okay? So sa lecture, i-discuss natin yan thoroughly, pero ang dormant phase class is, for example, na-infect ka ngayon ng malaria, okay? And then, gumaling ka, okay? Gumaling ka, pero yung hindi mo alam, class, is nagtago pala yung ibang parasite sa liver. Okay? Naging dormant sila. Okay? Hinihintay lang nila na bababa yung immunity mo ulit. And then, doon ulit sila magkakaroon na or magme-manifest ng infection. Okay? So, kaya nga dormant phase ang tawag. Okay? So, ano pa ba? Although class no, na serological test ang ginagawa, they are still considering thick and thin smear as the gold standard for malaria diagnosis. Okay? So ano ba ang ibig sabihin ng or ano ba yung test or paano ba pini-perform sir yung thick and thin smear? So okay, ito yung step-by-step procedure, no? So first you're going to label, okay, yung clean slides natin, wear gloves obviously because we will going to deal with blood. Okay? Select the site of puncture. Usually class, the site for pricking or yung capillary collection, okay, is the thickest or yung pinakamalaki. Okay? Usually class, hindi naman sobrang laki katulad ng thumb. Okay? Bakit yung usually class is the 2 middle fingers. Itong dalawa. Mamimili ka dito sa dalawa. Okay? Sir, bakit, sabi mo pinakamalaki, bakit hindi thumb? Sobrang laki naman ni thumb class at saka sobrang kapal din ng balat sa thumb. So baka pag prick mo, walang lumabas na dugo kasi makapal. So mamimili ka lang dito sa dalawa. Okay? Yung dalawang middle fingers. Okay? So puncture, usually class, sa gitna. And then wipe the first blood. Bakit nyo kailangan i-wipe yung first blood? Okay? Because your body fluids yan. Okay? Yung unang labas ng dugo class, body fluid. And also to wipe out yung contamination if meron. Okay? The first blood or the first drop of blood na lumabas, you wipe it. Okay? Because nga, again, body fluids and to prevent or to wipe out yung contamination, and then you start collecting on the second blood. Okay? So touch the next drop of blood with clean slides and repeat with several slides. Okay? Usually kasi class, ang ginagawa namin for malaria parasite, 5 to 10 slides ang kinukuha namin. Okay? Bakit sir 5 to 10? Okay? Hindi mo kasi malalaman sa isang slide lang. Baka yung first slide mo or yung first 3 succeeding slides mo negative. Doon ka pa nakakuha ng sample sa next slides mo pa, succeeding slides. So, usually class, at saka hindi lang siya once. Okay? For example, kumuha ka ng 10 slides ngayon sa isang quick mo, during the height, I think, no, ang pagkakaalam ko, during the height of fever, okay, nagko-collect din. Okay? Bakit? Fever class is an indication of infection. Okay? If the patient is suspected of having a malaria, okay, sa height of infection, doon madami ang antigen. Ibig sabihin, nandoon madami ang parasite. Okay, so magko-collect ka doon na area na yon. Okay? So, thick and thin. Okay? So, let's watch a video, no? What? Yan. Thick and thin smear class. Yan. If you notice, ito yung... Yan. This is a thick and thin smear. Dito class, ang ginagawa nila, iba-ibang slides. Iba sa thick, iba sa thin. Ang ginagawa namin sa lab naman, isang smear lang si thick and thin smear. Okay? And then you stain it. Okay? Usually, yung normal na staining na ginagamit for hematology, yun ang ginagamit for malaria. Okay? It's either Wright stain or the Giemsa stain. Okay? So, I will go to upload a video, no?
Malaria thick smear preparation, staining and examination. Thick peripheral blood smears consist of a thick layer of dehemoglobinized or lysed red blood cells. The blood elements, including parasites, if any, are more concentrated than in an equal area of a thin smear. Thus, thick smears have an increased sensitivity, allowing a more efficient detection of parasites. However, they do not permit an optimal view of parasite morphology. For example, they are often not adequate for species identification of malarial parasites. If the thick smear is positive for malarial parasites, The thin smear should be used for species identification. Sample: EDTA whole blood venous sample or capillary sample. Equipment: clean, grease-free glass slides, applicator sticks. Preparation of malaria thick smear. Use universal precautions while preparing the smears for malarial parasites. Label a glass slide with sample identification number. Mix the sample by inversion. Open the cap gently and check for clots by dipping the applicator stick in the tube. Next, using the applicator stick, place 3 to 4 small drops of blood on the slide. Spread the drop of blood with the corner of another slide or an applicator stick to make an area about 1.5 to 2 centimeters in diameter. Correct thickness is attained when newsprint is barely legible through the smear. Lay the slides flat and allow the smears to dry thoroughly. Protect the slides from dust and insects. Insufficiently dried smears and smears that are too thick can detach from the slides during staining. Protect thick smears from hot environment. Dehemoglobinization of thick smear. Dip dried thick blood smears once into a beaker containing normal water and take out immediately. Care should be taken to not wash off the smear during the process. Do not touch or wipe the wet smear. Alternatively, keep the dried smears flat. When dried, the slide is ready for staining. Staining. pH should be adjusted to 7.2 for staining for malarial parasite. A number of Romanowsky stains like Fields, Giemsas, Wrights, and Leishmans are suitable for staining the smears. Staining by Giemsa stain will be demonstrated here. If you are preparing your own stain, always prepare it fresh, according to manufacturer's instructions. Adjust the pH to 7.2. After the smear dries, label the slide on the thick edge of the smear with another glass slide or a diamond marking pencil. This is done as the earlier markings can be washed away while staining. Add 7 to 8 drops of Giemsa stain. Let the stain stay on the slide for 20 to 30 minutes. Rinse gently for 3 minutes in a buffered water. Drain, dry, and examine. Examination of the stained smear. Place the slide on the mechanical stage of the microscope. Focus the slide first using the 10x objective. Place a drop of immersion oil on the edge of the middle of the film. Position the 100x oil immersion objective over the film. Lower the oil immersion objective until it touches the immersion oil. Examine the blood film by moving along the edge of thick smear, then moving the slide inwards by one field, returning in a lateral movement, and so on. An area where 10 to 20 WBCs per field are seen in a thick smear is ideal for parasite detection. Examine a minimum of 100 fields in a thick film before declaring it negative. Appearance of parasite species. In a thick blood film with 100x oil immersion objective, no red blood cells are seen. The malarial parasites are seen along with the white blood cells. However, the parasites appear to be smaller in the thick film than in the thin blood films. The fine rings of cytoplasm of the trophocytes may appear incomplete or broken in thick blood films. WHO recommends that at least 100 fields, each containing approximately 20 white blood cells, be screened before calling a thick smear negative. Reporting of parasitemia in thick blood film. Infected erythrocytes are counted in relation to a predetermined number of WBCs, and an average of 8,000 per microliter is taken as standard. 200 leukocytes are counted in 100 fields. All parasite species and forms, including both sexual and asexual forms are counted together. For this, 2 tally counters are required, one to count leukocytes and the other to counter parasites. If more than 10 parasites are counted, then the following formulae can be applied. Number of parasites divided by number of WBCs counted multiplied by 8,000 gives us the number of parasites per microliter of blood. Or, if 200 leukocytes are counted, number of parasites counted multiplied by 40 gives us number of parasites per microliter of blood. If the parasites are less than 9, then 500 WBCs should be counted, and the formula will be number of parasites counted multiplied by 16 will give us number of parasites per microliter of blood. Quality control. Blind testing is conducted to assess the accuracy and inter-observer variance. If feasible, inter-lab comparisons can be done once in 6 months.
Okay, so papunta rin yung quality control, no? So hindi na natin kailangang discuss yun. Okay, so now let's watch yung video about thin preparation naman. Okay, that's the preparation for the thick. And again, ito naman yung thin preparation.
Malaria thin smear preparation, staining and examination. The thin peripheral blood smear is used primarily for species identification of malarial parasite. The thin smear preserves the structure of individual parasites with minimum structural distortion. Sample collection.
Thin films can be made from whole or anticoagulated blood. EDTA whole blood venous sample or capillary blood.
Thick and thin smears must be prepared immediately after the whole blood is drawn. If anticoagulants are used, the blood must be drawn in a lavender or pink top EDTA tube. Invert the EDTA tube several times to avoid the coagulation of blood. The tube of preserved blood must be received in the laboratory within 1 hour of collection for best results. If it is anticipated that the EDTA tube will not arrive in the laboratory within 1 hour, prepare thick and thin smears according to the following instructions and send the slides and the EDTA tube to the laboratory immediately. Equipment. Clean, grease-free glass slides and applicator sticks. Preparation of thin smears. Use universal precautions while preparing the smears for malarial parasites. Use clean and dry microscopic glass slides. Clean them with lint-free cloth. Label a glass slide with sample identification number. Mix the sample by inversion. Open the cap gently and check for clots by dipping the applicator stick in the tube. Place a drop of blood on one edge of a clean, grease-free glass slide. Place another slide at a 30 degrees to 45 degree angle up to the drop, allowing the drop to spread along the contact line of the two slides. This angle is important to prevent the leukocytes from bunching along the edges. Quickly push the upper slide toward the other end of the lower slide. Use the correct amount of blood and proper spreading technique to obtain a tongue-shaped smear or a smear with a good feathered edge. The thickness of the smear varies when the slide is pushed at various rates. The slower the motion, the thinner the smear. If the smear is too thick, the structural detail of individual parasites will not be observable. A well-prepared film is thick at one end and thin at the other. That is, a single layer of evenly distributed RBCs with no cell overlap. The thin feathered end should be at least 2 centimeters long and the film should occupy the central area of the slide with free margins on both the ends. Air dry in a box or other container to prevent dust from settling on the slides. Do not dry with heat. Staining. A number of Romanowski stains like Fields, Giemsa, Wrights, and Leishmans are suitable for staining the smears. Thin blood films stained by Giemsa's or Leishman's stain are useful for speciation of parasites, for the stippling of infected red cells. The optimal pH of this buffer is 7.2. Here, the staining by Leishman's stain will be demonstrated. Leishman's stain. After the smear dries, label the slide on the thick edge of the smear with another glass slide or a diamond marking pencil. This is done as the earlier markings can be washed away while staining. Next, place the dried slide on the staining rack. Add 7 to 8 drops of the stain. Leave for about 1 to 2 minutes. Then add 12 to 15 drops of buffered distilled water using a disposable dropper. Mix thoroughly. Leave for 4 to 8 minutes. Then wash off with clean water. Wipe the back of the slide with clean cotton to prevent stain deposits which can hamper the reading of the slide. Dry the slide and examine. Note: whenever a new lot of stain is received, verify the new lot. Stain 4 to 8 slides using different durations of staining and check which slide is stained the best. Use the same duration of staining for that lot of stain. Now, examination of the stained smear. Place the slide on the mechanical stage of the microscope. Focus the slide first using the 10x objective. Position the 100x oil immersion objective over the edge of the film where the red cells are the thinner. Place a drop of immersion oil on the edge of the middle of the film. Lower the oil immersion objective until it touches the immersion oil. Examine the blood film by moving along the edge of thin film, then moving the slide inwards by one field, returning in a lateral movement, and so on. Examine a minimum of 200 fields in a thin film. Parasitic index. To quantify the malarial parasites, count the parasitized RBCs among 500 to 2000 RBCs on the thin smear and express the results as percent parasitemia. Percent parasitemia is equal to parasitized RBCs divided by total RBCs multiplied by 100. Identification of malarial parasites. Malarial parasites take up stain in a special way in both thick and thin blood films that enables to distinguish the various parts of the parasite. They pass through a number of developmental stages. In all the stages, the same parts of the parasite will stain with the same color. Chromatin, or part of the parasite nucleus, is usually round in shape and stains deep red. Cytoplasm occurs in a number of forms, from ring shapes to irregular shapes. It always stains blue, although the shade of blue may vary between the malarial species. Stages of the malarial parasites that are seen in peripheral blood films are ring form. It is the earliest stage seen in all species of Plasmodium, seen as single or multiple rings with cytoplasm ring and chromatin dot. Trophozoite stage. This stage is most commonly seen. The trophozoite stage is a growing stage. The parasite within the red blood cell may vary in size, from small to quite large. Pigment appears as the parasite grows. The malaria pigment is a byproduct of the growth or metabolism of the parasite. It doesn't stain but has a color of its own, which may range from pale yellow to dark brown or black. Schizont stage. During the schizont stage, the malarial parasite starts to reproduce. This reproduction is referred to as asexual reproduction, as the parasite is neither male nor female but reproduces itself by simple division. Seen sometimes in P. vivax and P. malariae. The gametocyte is the sexual stage in which the parasites become either male or female in preparation for the next stage, which is the extrinsic phase, which takes place in the stomach of the female Anopheles mosquito. Gametocytes may be either round or banana shaped depending on the species. The various species of malarial parasites are: there are 4 species of malarial parasites that affect the humans. 1. P. vivax. P. vivax is the commonest species in India. It is the largest of the malarial parasites found in humans. 2. Plasmodium falciparum, which is also the common species in India and is responsible for conditions like cerebral malaria and even death. 3. P. malariae. P. malariae is a less common species in India, prevalent in some parts of Orissa, Madhya Pradesh, and Chhattisgarh. 4. P. ovale. This is not prevalent in India but is reported from many countries, especially from Africa. It is important to identify the various species as treatment regimen differs with the type of malarial parasite seen on smear and thus the importance of thin smears. Comparison of different malarial species on a thin smear. P. falciparum.
Infected RBC are normal in size and RBCs are infected by multiple parasites.
P. vivax has infected RBCs which are enlarged in size. They may show Schaffner's dots. P. malariae, the infected RBCs are normal in size. The ring form in P. falciparum are the delicate rings with 1 or 2 chromatin dot. In P. vivax, large rings, usually single with large chromatin dot. In P. malariae, sturdy cytoplasm with large chromatin dot. Trophozoites, P. falciparum, not usually seen. In P. vivax, in enlarged RBCs with Schaffner's dots. In P. malariae, compact cytoplasm with large chromatin with some band forms. Schizonts in P. falciparum, not usually seen. In P. vivax, seen as large structure with 12 to 24 merozoites with yellow-brown pigment. In P. malariae, 6 to 12 merozoites with large nuclei clustered around a mass of coarse, dark brown pigment. Gametocytes. In P. falciparum, they are crescent or sausage-shaped with clumped or scattered chromatin stretching the RBCs. In P. vivax, they are round to oval, almost filling the RBC with scattered brown pigment. In P. malariae, it's round to oval with scattered brown pigment. They may almost fill the infected red blood cell. Next.
Okay? So, skip na natin yung quality control. Okay? We will go to discuss that during our lecture portion. Okay? So, if you notice, class, no, magkaiba yung counting. Okay? Magkaibang procedure na ginawa. Although the same procedure or the same collection na ang ginamit. Okay? From the name itself, thin and thick smear. Okay? The purpose of them is for the thick is for confirmatory and for the thin is for counting. Okay? So, tingnan natin yung I'm going to upload another video, no? So this video is particularly on the collection portion. Okay? Ito talaga yung collection talaga. Okay? So ito yung ginagawa namin sa laboratory.
In order to perform a proper sick and thin blood smear, you need the following material. Gloves as universal precaution, dry and clean piece of gauze, a spreader, clean and clear glass slide of 25 by 76 mm approximately, small cotton balls soaked in alcohol, sterile blood lancet, a bin to discard used blood lancet, and a slide folder to protect slide from dust and The spreader, you need a slide with clean, frosted and polished edge. When you pass your finger on the edge, it should feel very smooth. If you feel any asperities or surface roughness, you should replace the spreader. Health worker should be comfortably seated with enough bench space and proper lighting. For pricking the finger, choose the middle or the ring finger. Always prick on either side of the fingertip, not in the middle. This is because the middle of the fingertip has more nerve endings than the sides. Therefore, pricking on the side is less painful for the patient. The patient should be seated comfortably. Then record a request form and a slide. Here it is done with a sticker, but it can be done on the thin smear with a pencil. Record should have at least a code or a name and the date. Check the slide is clean, free of dust or fingerprints. If not, clean it with a dry piece of gauze. Note here that the slide can be manipulated as long as you keep your finger on the edge of the slide. Massage fingertip to increase blood flow. Clean the fingertip thoroughly with a cotton ball soaked in alcohol. This step needs to be done properly in order to avoid contamination of the blood taken or infection for the patient. Open the protective wrapper of the sterile blood lancet from the back side. If you notice the protective wrapper has already been teared off or damaged, discard the blood lancet as it is no longer sterile and use a new one. Pull the lancet out of the protective wrapper and prick the side of the fingertip with a quick hand rotation. Discard the used blood lancet in a proper bin. Press slightly the finger. The blood should come out easily. If not, restart by cleaning and pricking another finger. With a dry and clean piece of gauze, wipe out the remaining alcohol and the first drop of blood as it may contain skin debris. Press the finger to have a blood drop out. Come with the slide to make contact with the top of the blood drop, but not with the finger. This is crucial if you want to take a standard blood quantity and have thick blood smear with a standard thickness. Repeat this in order to obtain 2 to 3 drops of blood for the thick smear. If the drops are small, take 3. If they are a bit bigger, take 2. The volume of blood for the thick smear should be about 6 to 10 microliter. For the thin smear, take 1 small drop, 2 to 3 microliter, about 1 centimeter away from the thick smear and in the middle of the slide. Give back the cotton ball to the patient, telling him to press on the puncture site for 1 minute. Hold the slide between your thumb and both your middle and index finger. With the other hand, take the spreader and put it in contact with the slide in front of the thin smear drop. Move the spreader backward to make contact with the blood drop. Wait for the blood to run along the spreader's edge. You can help that process by opening and closing the angle of the spreader in quick succession. Keeping an angle of approximately 45 degrees, move the spreader forward with a regular move. There is no need to apply too much pressure on the spreader, but it should stay in even contact with the slide surface when the blood is being spread. The forward move should be regular, not too fast, and completed until the spreader reaches your thumb. Then put the slide on the bench. With the corner of the spreader, join the 2 or 3 drops for the thick blood film with few circular movements in order to obtain a circle of about 12 mm in diameter. Place the slide in a slide folder to protect it from dust and flies. Leave it there until blood has completely dried. The folder should be on a flat and level position. If not, the blood for the thick blood film will run on one side, so you end up with half of your thick smear too thick and the other half too thin. Then clean thoroughly the edge and corner of the spreader with a cotton ball soaked in alcohol, and then a clean piece of gauze. The spreader must be cleaned before you proceed to the next patient in order to avoid contamination or parasite transfer from one slide to another. Here it is just to show you that when the drops are bigger, only 2 will be enough for the thick smear. On a standard thick smear, before it dries, you should be able to see newsprint through the thick smear, but barely able to read it. After staining, a standard thick smear on a patient with a normal WBC count should have approximately 10 to 15 WBC per eye power field. To perform a good thin smear, your spreader should go forward in a regular move and not too fast. One of the common mistakes is that a too big drop of blood is applied on the slide, and then you need to spread the blood fast in order to keep the thin smear within the further edge of the slide. Remember, a small drop of blood, 2 to 3 microliter, is enough for the thin smear. On a well-performed thin smear, the tail of the thin smear should dry very quickly, and looking through, you should be able to see rainbow-like colors in that area. Here, I complain with my staff who forgot to clean the spreader after smearing.
Okay? So, yun ang proper way or yun yung technique na ginagawa namin sa laboratory, no? So, iisang slide, 2 smear na. Okay? If, for example, malaki yung drop, so 2 drops lang, okay? Wipe the first drop na lumabas and then start with the second, okay? Una mo kukunin yung thick, okay? And drop another one for the thin. Okay, isi-spread mo siya katulad ng ginagawa sa hematology. And then the thick naman class, use the edge of the slide para i-mix siya or i-spread siya circularly from inward outward. Okay? So, and then after the class, i-dry lang siya, air dry. And then you stain it using yung normal na ginagamit for hematology. Okay? So for your activity today class, you're going to I will go to upload now. Hindi ko pa siya na-upload yung activity manual natin, your activity number 7. Okay, the activity number 7, you're going to draw. Okay, the appearance of the malaria parasite on thick, and you're going to draw again the appearance of malaria parasite on thin smear. Okay, and then there are follow-up questions. And for your quiz for today, I am going to upload questions after this conference. Again, I am going to upload questions for your quiz after this conference. Okay, so the deadline for the quiz class is within this day. Okay, you need to submit the quiz before the end of this day, and for your for the activity, the deadline is Monday next week. Okay, do you have any questions regarding our conference or regarding the activity? May tanong ba kayo? Okay. So I guess wala na, no? So after this conference, I'm going to upload the question and the activity. Okay? So I guess this is wala na tanong. Okay? So this ends our conference and our laboratory activity. Okay? Thank you everyone and see you tomorrow for another live demonstration and activity laboratory conference for this week for the week 7 week 8. Okay, I think week 9 nata. Okay, again tomorrow for another laboratory conference for clinical parasitology. Okay, thank you everyone and be safe. Bye.